Hey guys, it's Lisa from Mass Attack. Today I want to talk about PICC lines. Somebody had asked me a while back if I could do a video on PICC lines, and to be honest, it kind of fell off my radar until pretty recently when people started having a lot of questions about their PICC lines again. So I'm really sorry if this is coming to you after the point at which it is useful, but I'm putting it up now, so hopefully it will help somebody at some point. Okay, so PICC lines are peripherally inserted central catheters. They are a type of central line, which are essentially like long-term IV lines. They are usually put in for people who require long-term IV therapy. Even if there is sort of like a time limit on that therapy, like if it's somebody who's going to do chemo for a year, and maybe that chemo could be damaging to the veins, they will often give them a PICC line to decrease the risk of damage to their veins. So there are like several reasons why you get a PICC line. So if you're doing sort of like a chemo type therapy or something that's sclerotic to the veins, is one reason. The other reason is, there's actually a less risk of infection, with a long-term single-placed PICC than there is with, going to the hospital 3 times a week and getting 3 separate IVs and, with as many sticks as, that requires. I know that I personally am, like a world-class terrible stick. I have so much hardening in my veins from having so many IVs over the years and from, just mast cell disease and various medications and, whatever. It was taking trained IV nurses like over 30 minutes to get a line into me, and then it was like often blowing, and I know that this is an experience that a lot of us with mast cell disease have. So I mean, one of the benefits of the PICC for sure is the fact that I don't have to constantly deal with sort of like the stress and pain of like people trying to like repeatedly get lines in me when I know that it's going to be fruitless. The risk of infection, as I mentioned, is also less, and another huge benefit is the fact that having a PICC line often allows you to do sort of your own therapy management at home. I give myself infusions at home. I do all my push meds at home. I also draw my own labs at home. So instead of having to go to the hospital like 3 to 4 days a week, like I was having to, it's definitely a much sweeter setup, and it makes my life a lot easier for sure. All right, so let's talk about PICC lines and the risk of infection. So it is definitely one of the biggest risks. There are, some other risks to having PICC lines, but I think that infection tends to be the one that is probably the most famous because it has potential to potentially be catastrophic. So there are essentially 2 types of infections that you're dealing with, or that you're risking when you have a PICC line. So just to be clear, PICC lines are inserted in central veins, which usually means that they're inserted into one of your arms, and then the line is fed through, okay, and the end of the line is not particularly far from your heart, okay? So when you push medicine through your PICC line, it enters your body immediately above your heart, and that's why it's available so fast, is because, it then is, circulated very quickly with all of your blood, basically, essentially from the source of all of that circulation. So the first type of infection is a more minor infection, comparably, like a local phlebitis or a skin infection. And basically what this is an infection, generally when bacteria from the skin are transferred into the vein, but not into the PICC line. This usually happens when you're changing your dressing or if your dressing comes off. Okay. And, this is generally a local infection. It absolutely can be serious. Skin infections certainly can be serious, and they also can be very hard to get rid of. But they are hands down easier to manage than central line infections. Central line infections generally you get from contaminating the lumen of your PICC line. So the lumen is the tube, okay, the inside of the tube. So sort of that space inside where you're pushing medicine through and you're pushing saline and heparin or whatever, right? So it's really easy to contaminate things, and it would basically be something like, you uncap your sterile saline flush, and as you're putting it, screwing it into the PICC line clave, it slips and hits your thumb, and you then use that, you don't throw that flush away, and you use the same flush, okay? Like, you then connect it to the PICC line and you push it through, and you have pushed lots of bacteria through that line, and that can absolutely cause a central line infection. I used to develop bloodstream diagnostics for bloodstream infections for organisms like Staph aureus and Enterococcus faecalis and, some gram-negative organisms and, various things. And, these infections are extremely serious. Like, I really cannot sort of overemphasize enough that you do not want to get a bloodstream infection. You do not want to get a bloodstream infection. Okay. You need to be very careful and you need to be very aware of that possibility if you have a central line in order for it to be a viable option for you. If you get one of these infections, you are absolutely spending time in the ICU, and on, very serious antibiotics. If it is antibiotic resistant, you may need to take something like vancomycin, which is very problematic for a lot of people with mast cell disease. A lot of us have problems with various antibiotics. So, and these are very serious medications, even without sort of, the comorbidity of mast cell disease. And yes, people die from bloodstream infections, so, I'm not trying to terrify you. I deal with my line, all the time, and I access it, every single day, sometimes multiple times a day. And I have had absolutely no problems with it. But the reason that I don't have not had any problems with it is because I spend a lot of time on it and I'm extremely careful. I actually just recently had a conversation with one of my providers and in which she was like, you've had that line for, 6 months and, how have you not, when did they change it? And I was like, they didn't change it. It's like, it's fine because, it's sterile and I keep it very clean and I'm very careful to make sure that my dressing stays on. And, it's a pain, it's time consuming to make sure that, everything is sterilized and, you sort of wipe everything down appropriately. But, I generally try to live my life in a way so as to avoid bloodstream infections. And I definitely recommend that you do as well, because they are absolutely the more serious risk.